9 years ago, my son Ryan died by suicide, and I didn't know anything about mental illness and realized that this is something that should be talked about by every family, every child. I would go with Ryan to his appointments, and I would sit in the room with them and hear them discussing and talking about things. But Ryan wasn't getting better, and people were not listening to that. Ryan had fabulous interns, but they rotated every couple of months, so there wasn't any consistency in his therapy. I think that was a big part of what happened, because then he'd have to retell his story over and over again. I hear plenty of stories about where people are in this whole having lost their services and then been unable. And again, one of those problems is when somebody goes for therapy, they develop a relationship with someone, and if Medicaid's no longer going to pay or that agency is no longer there, they have to start over. So I've heard many stories about people having to start over and then just giving up and not going for the help that they need, because talk therapy is a really important part of treatment, not just the medication. I have heard it said that New Mexico is one of the worst states to have a mental illness, and I totally agree. I think until we can make some changes, people are not getting the services. They're not able to access the services that are here. And I've even heard people who've moved out of state so that they could get their child the services that they need.